My name is Roberta Russo. I work as the External Relations Officer for the United Nations Refugee Agency operation in Somalia. Somalia is facing one of the biggest humanitarian disasters and crises in the world today. It's generating among the highest number of displaced people in the whole world. We have 500,000 Somali refugees living in countries neighboring Somalia. We have 1.4 million internally displaced people who are settled all over Somalia, but most of them are in the south central region of Somalia. Most of the ones who manage and have the luxury of escaping from Mogadishu, they go through Galkayo, which hosts for over 40,000 internally displaced people, and some of them to Bosaso. The money that the Australian people have been donating for the Somali women are going on health centers that are in Galkayo and some to Bosaso. The situation in Somalia is particularly worrying because the Somali displaced people are settled in areas of the countries that are too dangerous for humanitarian workers to access. So very often you see that entire families don't access any help, while they don't have any access to water, any shelter to spend the night under, any children don't have any education, and there is no medical care that they benefit from. Well, I just think that the experience that displaced people in general in the world have to go through is a very tough one. It's particularly difficult for women and children who are displaced because very often women, especially in the African context where I'm working, have very little coping mechanisms, basically. And when you are displaced and you are away from the place where you grew up and you're born, away from your social links, it's very hard for a woman who is displaced with children to find a way of sustaining and feeding herself and her family. Okay, fertility rates in Somalia are very high. On average, the fertility rate is 6.5. The infant mortality is alarming. There are 81 children on 1,000 children that die before the first week after they are born, and that's obviously related to the fact that the delivery conditions for the women and the baby are not conducive enough. With the help of Australian donors, UNHCR has been able to purchase over 1,000 safe delivery kits. The kits have very basic items. They have sterile cotton, they have strings to cut the umbilical cord, they have soap. But these basic things are things that women in Somalia lack. And these basic things are things that can make a change in their life, and they can basically help them to survive and to go through the delivery. The healthcare sector in Somalia is facing huge problems, and one of the reasons for it is because of the conflict. The conflict has killed a huge number of health workers in Somalia. And therefore you find that hospitals not only don't have the facilities and to help the women, but there is lack of medical care and of competent medical care. And that's why this program is particularly important, not only because we deliver the safe delivery kits, but also because we help training the health workers who work in the clinics on how to deliver, how to help women deliver safely. This program that UNHCR was able to implement thanks to the Australian donors is key because it can save the life of many people, and tens of thousands of people can access now these health centers that have the safe delivery kits. And of course this has a huge impact on the lives of the displaced women that access these centers because they have less of a risk of dying during the delivery. I know today you are all gathered here to celebrate the Australia for UNHCR annual Mother Days lunch, and I would like really to sincerely thank you on behalf of the Somali women who have been able to be helped by the reproductive health program that you have contributed to fund. You have made a huge difference in the life of women. You basically helped women to survive and to go through their delivery, and you made a huge difference for the women living in Somalia. In the future, UNHCR Somalia definitely will need the support of Australian donors and other donors to continue this program that has a huge impact on the life of the Somali women. Again, there is no such kind of programs. They're not very common in Somalia, and that's why there are so many women who die during delivery. So it's extremely important for us to be able to continue this program that has benefited a lot of women.